I'm here today with Dr Malcolm Linsell. Now, Dr Linsell is a well-respected plastic and cosmetic surgeon who's based in the Cosmetic Surgery for Women, which is in Hawthorn in Melbourne, and the Medici Clinic, which is in Berwick. But he's also just recently taken on working up at Rockhampton and Townsville in Queensland, which is great because we get so many people wanting someone up north.
And Cairns.
And Cairns as well. Oh, great, awesome. Among other specialties, Dr Linsell is known for his work with mothers wanting to regain their pre-pregnancy bodies and women basically over the age of 35 who are just not want to feel a whole lot better about themselves. So we're just going to have a little chat about that today. So thank you so much for taking the time to talk with us today, Dr Linsell. Look, what do you see as, it's interesting to think that at the same time that the average age for women having babies is getting higher, it's rising, that the cosmetic and plastic surgery industries are actually becoming more accessible and accepted to society than ever before. And what do you see as being the most popular and increasing procedure that's being asked for to you at the moment by women?
Yeah, it's really interesting because you're right, plastic surgery has become more socially acceptable, and I think that's one of the major reasons why women are seeking these sorts of procedures. The most common operation is probably still breast augmentation. Liposuction is also common, and in my hands in particular abdominoplasty, because it's something that I've sort of taken a real interest in, over the last 25 years or so. And I think the use of liposuction with abdominoplasty to give a more contoured result for a woman's tummy. Most women, after they've had their pregnancies, hate their tummies, particularly because the skin's loose, they've got fat that they can't get rid of no matter how much diet or exercise they do. And in particular, the muscle that has given them a flat tummy up until they started to have children just doesn't come back together again in the midline. And they're wanting a more shapely, tighter, flatter tummy. And that's what we offer with a suction-assisted abdominoplasty, where we combine liposuction with a traditional abdominoplasty.
Okay, because I had abdominoplasty years ago
Did
for
you?
that very reason, but there was no liposuction around at the time, so it was a long time ago.
Yeah.
And I just know how it made me feel, how that skin made me feel like I was just absolutely gutted. I didn't even want to look at myself in the mirror or anything, so I know what it's like for a woman who gets this done. How much better it makes her feel. So I know that that's one of your favourite parts about your job.
It is. Women hate it.
Yeah.
It's the effects of pregnancy, which in the past essentially women just put up with it. But nowadays there's more choice, and yes, women are having children at a later age. They are financially independent, and they are choosing. They're saying, "Well, this is what I want to do," and it's not because they want to look different. It's not because they want to look better. They want to go back to their more youthful their more youthful bodies, and to give them that with their tummy or their breasts or their faces is something which I love to do, because when a woman is confident, when she feels happier about herself, then everybody benefits.
Exactly.
In particular, her partner and also her children, but I think everybody who come into contact with her. Since I had a husband recently who 6 months after I'd done a tummy on a lady, he said, it's as if she now shines from within. And I thought, from a husband to be saying that, that's awesome.
It's true.
That's always been there. But I think we're just unlocking it, because she's now got the confidence back to actually be who she really is. That's why I love doing what I do.
Exactly. And we do get quite a lot of backlash as well, people saying, why can't you just be happy with what you got? And I always say, more power to you. If you're happy, that's fine, but if someone hasn't walked in your shoes, they can't explain how you feel.
That's
and
exactly right.
I cried when my bandages came off. I couldn't believe it, but yeah, I know exactly how that is. All right, and because of the increasing in self-confidence, it's a lot more socially accepted by people do it as well. But we also get a lot of inquiries from a lot of massive weight loss patients, people who've had bariatric surgery and then need to have those things done to to make themselves happy. It's almost like the next step. Do you perform many of those procedures as well?
In particular, for me, my specialty is abdominoplasty, so I often will do the abdominoplasty side of it. However, some of my other colleagues are better at doing so-called body lifts and other parts of that.
Okay.
So for me, it's mostly abdominoplasty and also some breast surgery.
Yeah. Okay. Great. So, for example, you work as a team. So
Absolutely.
it's not just you do everything. It's actually whoever's best at this does this part. Whoever's best at this does this part, and whoever's best at this does this part.
Well, I'm really privileged, both working in Melbourne and also in Queensland.
Yeah.
I work with guys that I've known for more than 20 years. So plastic surgeons, say in Melbourne, we've got more than 60 years experience and working, and it's similar in Queensland actually. And so if there's something that I think that someone else is better at doing, then we actually refer to each other. And often we will operate together, so both of us can get, or the patient can get a better result.
Fantastic. And just one last question. I get this answer a lot, so I'm going to ask you as well. As far as doing more than one procedure at a time, is there a limit as to how long you think someone's safe to be on the table, or is that not? It depends.
It's a great question, and I think that's one of the major advances over the last 25 years, is the type of anaesthetic and the way people come through anaesthetics. They are much safer and they wake up much better after an anaesthetic. And I think there's really no limit, if you like, and I think a procedure that takes somewhere between 3 and 5 hours is still possible for the patient to feel well after the operation. And just this week I've done a young woman who's had a breast augmentation, a tummy tuck with liposuction around her tummy, and also liposuction onto her outer thighs. That took 3.5 hours, and yes, she's come through it really well. And that is becoming more common. I hate the term mummy makeover. However, it's that rejuvenation of a woman's body back to how she used to be. And often they want to get it, particularly because these are professional women, financially independent, and they want it with minimal downtime. So I think if we can provide that service and it's safe, then I'm very happy to do it.
Fantastic. Well, thank you so much for taking the time to talk to us today. For all you ladies and gentlemen out there that always ask about Melbourne, where to go, there you go, there's your answer. Cosmetic surgery for women. There's 5 plastic surgeons that work there?
There's 3 plastic surgeons plus an ocular plastic surgeon.
Okay. And someone in training as well, so it's a gamut, it does everything. So thank you so much, and thank you for taking the time to talk today.
You're welcome. Thank you, Trish.
Thanks very much. Bye-bye.